Good morning. My name is Dr. Melody Medley Keith, and today we are talking about hip pain. So, if you have hip pain, what is a good way to figure out where is it coming from? Is it really coming from the hip? So, today, our Snapinar, our topic is on hip pain. Is it really in the hip? How can you tell? So, what we want to do in physical therapy is when we get a patient, they say, oh man, I got hip pain right here. So what we do is we try to decipher, is it coming from the back? Is it coming from your pelvis? Or is it truly coming from the hip joint proper? Right? So those things are what we try to figure out. That's through all of our special tests and the things that we do. But what I wanted to do today is to kind of give you a little bit of example of biomechanics. And what we're going to look at, and I'm going to show you, is range of motion, right? So today we are talking about hip pain. So for those of you that have hip pain, and if you do something, you do turn or you twist and you go, wow, I've got this pain right here. Right here is where it hurts, right? So now, what can you do at home to try to decipher if it's truly coming from your hip? Well, the first thing we've got is a self-assessment. You're going to self-assess. So you're going to need just a little bit of a yoga block. You could use a pillow too, and just any kind of a belt, right? So you're going to come in and just straighten your legs out. You can even lie down flat, and I want you to just do a log roll test. So what we do here is we take your leg in and take it out. And you're trying to keep the knee as straight as you can. You're just rolling the knee from the hip. If you feel more comfortable lying flat, that's fine. So what you're going to do is go, ooh. And when you do that test, if you go, wow, I do kind of feel it right here when I go in, but I don't feel it when I go out. But it's not bad. I feel that, but there is something there. So the log roll test is the first one. The next one is you want to check for your hip range of motion. So this one I am going to lie flat. I'm using my belt. I'm going to come in and you're going to check. Okay, well, I feel a little bit there. Ooh, but it just, wait. Let's check the other one. And you go, oh, wow, I go a lot further on this one. Why can't I go on this one? I'm pulling, but it won't go. I do feel it a little bit here and here. So, oh, okay. So hip flexion test. So the next one is our hip internal rotation test. And what you're going to do is take your block, bring your knees up to 90, and you're going to try to work hip internal rotation. And you're going, when I do that, that's where I feel the pain. Right there. You're not feeling it in your back. You're not feeling it back in your SI. You're still feeling it in the hip. So there's your self-assessment. So for those of you that do the assessment, and all of a sudden you go, well, I don't really feel that in my hip. I feel it more in my back, or I felt those in my back. So there's your suspect of might needing to get your back checked. And we can do that here at Lakeway Aquatic Physical Therapy. That's what we do. But for those of you that feel it in your hip, guess what? The tests are your exercises. That's why I love to say that. The tests are your exercises. So what you want to do is to go back and do the log roll test. Do the hip flexion test. So you're going to go in and actually work on range of motion, but not killing it, right? Don't try to push too hard and go too fast. Go slow. Go easy. But you want to do these 2 or 3 times a day, going slowly, using your props to help you, and make sure that you're working it. When you feel the pain a lot, don't push it any harder. If you feel it a little bit, try to get in and move it a little bit. Move it around. Get the mobility back into the hip joint. That will help your pain. So, if you have any other questions or any other thing that's going on, please give us a call. You can always just pop us a note here in our Facebook Live. We'd love to hear from you. If you have any other comments, any other things that you need, just call us here at Lakeway Aquatic Physical Therapy. If you need any other things online, just look at our website at www.lakewayaquatics.com. And that's where you can find us. We appreciate your time. If you have a chance, please give us a thumbs up. If you want to follow us, please hit the bell. Okay? Thanks. Bye-bye.